So as Republicans and Democrats in Washington spar over a spending deal, a different budget standoff in the state government also hit a key deadline today. And how both of these fights get resolved could ultimately impact health care for millions of people in North Carolina. WRAL state government reporter Will Doran is following all of this for us. Will.
Yeah, Lena, the federal government shutdown is largely over Obamacare, which is how nearly 1 million North Carolinians get their health insurance. Meanwhile, the state funding fight is about Medicaid, and that affects another 3 million North Carolinians. So together, we're talking about nearly 40% of the state's population being affected by these two different fights.
That's obviously huge. So bring us up to speed on the federal shutdown fight here. What are we hearing from local members of Congress?
Well, Republicans say that cutting Obamacare subsidies is going to lower government spending and help pay for President Donald Trump's tax cuts. Richard Hudson, a Southern Pines Republican, thinks that most people will support that plan. Here's what he had to say today. Quote, Democrats chose to play politics with people's lives and force a wasteful and unnecessary government shutdown. But if the GOP plan goes through, then some of those million North Carolinians on Obamacare could soon find themselves having to pay over $1,000 a month for insurance. And we heard today from Chapel Hill Democrat Valerie Foushee, who says that that is worth fighting to stop.
These are working families, teachers, nurses, small business owners, and parents trying to afford a doctor's visit for their children. They should not be collateral damage in this Republican-manufactured healthcare crisis.
So, Will, let's talk about the state level and Medicaid cuts. That's obviously a big issue as well.
Yeah, Lena, Republican state lawmakers have so far failed to pass a new state budget. And today, because of that, Medicaid cuts are going to go into effect. Now, it's hospitals and doctors who are going to be immediately affected by this with lower rates from the state. But if that causes them to start seeing fewer Medicaid patients, then those 3 million North Carolinians who are on Medicaid could soon find it much harder to get a doctor's appointment at all, something we'll obviously be watching very closely here.
Yeah, lots of uncertainty for a lot of people in our state when it comes to something so important, which is health care. All right, thanks so much, Will. And you can, of course, find plenty more coverage today of how the shutdown affects people in our state online at WRAL.com.